If you've been in the office and you feel that you're getting benefits from being adjusted, but you want to know what you can do outside of the office to make sure that you maintain your adjustments, that's what tonight's all about. Our hope is to make sure that we continue to remind you that there are things that you do, habits you have, positions you sleep in, stand in, sit in, that are affecting you on a daily basis. So we want to make sure that we give you the top 5 or 6 tools that can help you to maintain the adjustments that we're giving you so that we don't have to readjust the whole spine every single week. Hygiene. When people say, oh, you need proper hygiene, what do we usually think of? Cleanliness, usually, right? Hygiene. Brushing your teeth, taking a shower, bathing, cleansing your body. Well, your spine needs hygiene. You only get one of those. You can't replace them. So we want to make sure that you know how to take care of your spine and do spinal hygiene exercises and, really positions when you're at home. Small daily habits that your spine needs in order to be healthy and strong and aligned are what we mean by spinal hygiene. It could take as little as 2 minutes like it does to brush your teeth, maybe 10 minutes. But there are small, little, simple steps you could take every day that could try to prevent decay, deterioration, and rot, just like your teeth, in your spine. Arthritis, disc deterioration, restrictions, immobility, lack of even balance, all comes because your spine becomes deteriorated over time if you don't take care of it. But every single day, your spine is getting stress from, at the minimum, gravity, right? Gravity is pushing down on our spine. We need to be able to decompress and take gravity out of our spine. And so we're talking about how do we do daily small habits that keep you healthy and strong and aligned. Remember, on the reverse here, many of us have small daily habits that take us into an unhealthy spinal position, that make us weaker and become more misaligned. Computers, phones, even our beds, the way that they're supporting us, all these things can start to cause us daily stress that builds up to cause the whole reason we do end up in my office, okay? So how do we keep you from needing as much care? Your spine is working a lot harder than you think, absolutely is. Because we're not aware of every single thing that happens in our body, you couldn't possibly know all the things your body's doing, even just your spine, to keep you upright. If you were aware of every single signal that your spine, your nerves were sending to your brain, you'd go crazy. You think you're having troubles now. Just think if you knew of every little change in chemistry, irritation, stretch, movement, digestive, your brain would go crazy. It'd be ADD on steroids. So your body is doing a lot to keep you erect, to keep you upright. So what we're trying to do is help you prevent injury that is happening in little small repeated stressors over time. Small repeated stress is what starts to break us down and has us wondering what happened. It's that 1,000th straw that breaks the camel's back. If we are not, though, taking small steps every day to help supporting our alignment in our spine, we're becoming sicker. A sick posture is a sick human being. It's kind of like we'd say, this is death by 1,000 paper cuts. That's what happens over time. Poor posture, too much sitting, weak core muscles, all that adds up day by day. You add certain emotional stressors, you add chemical stressors from the foods that we're eating, your body starts to scream for help. So what are some of the things that you can do between adjustments? We're going to go through a handful of those things. Some of the tools. Number one tool for anyone is movement breaks. Your body was built to move. God did not give you all these joints to just sit there and not use them. When we don't move, we slowly start to deteriorate and degrade the discs in our back. And if I were to take your spine and lock up 2 areas of your spine and not let them move for 2 weeks, only 2 weeks, if I fused them together for 2 weeks, it would actually start to cause on a microscope arthritic changes in the cartilage in 2 weeks. Add 2 months, 2 years, or 2 decades, the discs will start to show up deterioration, and you'll have fixation and restriction of motion. So we must move. This is why, for me, a movement break is so great as using these discs. This is part of our spinal, our home rehab kit, which we'll get to probably. But just sitting on something like this and doing some extra motions can really start to hydrate those discs in your body. Get up and walk, even if it's for a couple minutes. Stretch, do what we'd call that power posture, where we're extending our head, we're opening our chest up. I think we should all practice that today. So everyone at home too, I want you to sit back into your chair so that your buttocks on the very furthest, part of your chair, so that's hitting the back of your chair. Make sure that your head is upright, nice and tall. And what I want you to do while you're sitting there is to open your palms up so your palms are facing the ceiling. Why are we doing this, do you think? Most of us, when we sit all day, we're hunched over. We're in front of ourselves. And our shoulders and our pecs are rotated in. We're looking at a computer, we're looking at our phone, we're sitting slouched. So in order to change that, we open the palms up, that stretches our chest open, and that gives our bodies an extension, because usually we're in flexion. So a posture movement break, you're gonna open your chest up, palms to the ceiling. Then the next thing we're going to do, because we're usually in flexion, is because we're looking down too much, we're going to extend our head. You want to try to get your head flat. Your head should be parallel to the ceiling. When we test you in our tests, that's what we're looking for. Your head to be parallel to the ceiling. So you would take a couple breaths. Take a couple breaths just like that. Deep breath in, hold it at the top for a couple seconds, and let it out real slow. Slower than you let it in. You could just sit up in your chair and do that. You could stand and do that. You could just get up and walk around. But these are movement breaks. These movement breaks are huge if you are sitting still for any more than an hour. Every hour you better get up if you've been sitting. If you do work on a computer or you're on your phone a lot, setting up a workstation that's more ergonomic is important. So ergonomic means you're going to set things up so there's less stress on your body. If you have a phone that you have to hold a lot during the day, well, if it's down here, it's putting a lot of pressure. You should probably be holding it right up here. You're not going to hold it up there very long without getting tired, so it'd probably be very important you get like a stand, right? Like this stand I use for this thing. Something like that to put your phone on. That way you could look at it straight on. You could sit down and it would be right in front of you. You could tap and use things without holding it, right? If you have a computer, your computer better be at eye level. So the screen should be right there at eye level when you're typing. If your computer's down, you're putting a lot more of this flexion in. But just know if you're doing something, anything you're using often should be right in front of you and should be at eye level. If you're having to type on a keyboard, that's okay, but just make sure that your arms and your hands are probably about like 90 degrees. They should be relaxed here, not way up here, not way down here. But most things should be right in front of you. You use a phone a lot, the phone should be right in front of you. Pick it up. If it's always to the side, you're going to end up going here a lot and to one side. Holding and pinching a phone like this, no. If you do that very long, you're definitely going to end up with more subluxations, not less. So how do you prevent needing as much adjustments? You get a headset. So these are things that, I'm just thinking of, but ergonomics, setting up those workspaces properly, you can look at our other workshops. The posture reset, we did that with the movement breaks. We just did a posture reset. I would say every hour, you should have some sort of an alarm or buzzer go off that reminds you to just snap out of it for a moment and just sit tall. One thing that most people do when they think about getting better posture, they kind of come backwards. That's not the key. We want you to go tall. Just imagine there's a string at the top of your head and it's pulling you straight up like that. Okay, that's really what a posture reset is. You could practice that while you're walking, while you're just even standing. Practice that posture reset, not just when you're sitting. Working on core strength is huge. One thing that I like to promote, because I think it's you get two things done at once, is balance exercises. If you're doing balance exercises properly, you're actually having to contract your core just to stay upright. So if I was practicing balance and doing that for 30 seconds on each leg a couple times a day, number one, you'll pass our tests that we ask you to do. And number two, you're actually having to contract your core. But it's very important if you're doing a balance exercise, you kind of keep that knee high. That challenges it more. And we have, again, posture check. We want to be straight up. So if you're doing this, you're actually producing a lot of core contraction. Another way to help that core is posture disc, which we'll get into again in a second. You can help strengthen your core. You can get fit while you sit. It's like an infomercial. So the other thing that, in the core can be many different ways. You could do planks. We have a whole sheet of 6 exercises to help your core. So if you ever need that, ask us. Some of the simple ones, we call them bird dogs or bridge exercises. There's a lot of ways to do that, but core is very important. We get weak when we just don't use our core. We let the chair sit for us and we don't sit tall. Your sleep. So when you go home and you have a great adjustment, your body's in good alignment, but then you lay down for 6, 7, 8 hours and your mattress isn't supporting your spine either. Let's say if you're on your back, it's not keeping it flat, or if you're on your side, it's not maintaining it in a straight position. Maybe your hips a little heavier and your bed isn't supporting your hips, and your spine is in a crooked or twisted position. If your pillow isn't the right size, your head may be tilted or twisted. So your sleeping positions and the support you have are very important. We have a mattress company that we recommend called Sattva. If you guys need information on that, we really like them. They're chiropractic approved, and they have many different mattresses and ways to kind of figure out, well, what kind of mattress do I need? The second thing would be the right pillows. We use PillowWise for most people. It's a way we measure you for the right size pillow. That's support. When it comes just to the sleeping position, I have patients most people who end up on their side end up kind of twisted, where the top knee is kind of going down to the bed, so they're twisted in a way that their spine is actually kind of twisted when they're sleeping. That's actually affecting your lower back significantly. So we always would suggest, if you're going to be on your side, a pillow between your knees. Okay? They sell even pillows that will strap to your legs so that they don't just fall out. But the pillow between the knees is very important. Some people, you might really rotate or twist yourself. You might want to think about a full body pillow. You could get it between the knees and then kind of keep you from rotating too far forward. But keeping yourself, again, in that proper alignment. If I'm on my side, I don't want to be tilted or distorted in some ways. We want to be straight. So you have the right pillow and the right mattress supporting your sides. If you're on your back, Most people would benefit probably from having a little bit of a pillow underneath the knees. A lot of people more and more are getting beds that can adjust, and it's all well and good. I'd say it's great if you're in bed and maybe you're reading, or you're trying to be in kind of a zero gravity position, or you're watching TV or something, which I don't recommend watching TV much past an hour before bed at all, because it will start to disrupt your sleep, or being on your phone or tablets. But if you're in your bed and you can raise it up, that's fine. But to fall asleep with it in somewhat of a zero gravity position, if you go onto your side, that may or may not keep you straight. That actually might be distorting you. So I have patients who don't realize this, but they say, oh, my bed can do this wonderful zero gravity, but then they go and turn on their side, and they may not actually be keeping their spine in good alignment. So just be aware of that. What can you do? Well, you can take a picture of yourself when you're sleeping, or try to take a video, try to figure out what positions are you in. Or even those wedges that a lot of people are given because of digestive issues. First thing I would tell you is please see our nutritionist and see if he can help your digestive issues, rather than just laying on a pillow that's tilted and probably distorting your spine just so you don't have indigestion. I know it's horrible. No one wants that at night. It's really hard to deal with. But just to have a pillow that tries to prevent it is probably not the best thing. There are probably more deeper issues to look at. But those pillows, again, they're probably, if you're on your back, yeah, they'll tilt you up. It's not the end of the world. But if you go on your side, what's that pillow doing? It's probably not keeping you in a good position. So sleeping position, I would recommend back or side. And those are the positions. If you're on your side, you definitely want support between your knees. If you're on your back, maybe a pillow underneath your knees, or you can raise those feet up a little bit, but just be careful with the beds. The last thing I want to talk about was a home rehab kit. I've, over years and years, been trying to find things that can help support the issues that I see people have that come in here with their spinal curve problems. So a lot of people, when they come in here, their neck is flat or straight. It's not curved properly. Their lower back may be kind of slouched or hunched. We've started this home rehab kit that has these blocks that helps to reintroduce curves in your body, because those curves are life. Those proper curves are going to absorb the gravitational shock, just like a spring. When you lose those curves, your nervous system is deteriorated to some degree in its ability to communicate. So to try to get those curves back isn't something I can just adjust. It's something you have to traction over time. You have to develop. So these blocks will act like traction tools as well as an exercise tool. So what you can do on these blocks, which I love so much, is you can get your core working. The one block that's more this triangular one, that can actually be underneath your low back, and you can do exercises with your crunches. You do hip movements. With the neck one, you can start to strengthen your neck by going back and twisting side to side. So if you're trying to exercise your spine and really give it movements in all the vertebrae and give it strength, these blocks are probably the best thing you can do. And once you're done strengthening them, then you can just lay there and traction on them, and we call that spinal molding. We can remold your spine. It might take 10-15 minutes a day. Now, usually with part of a home rehab kit, and if anyone hasn't gotten information on this before, we have a sheet here that you can go and kind of look at all of that stuff, but it shows all the exercises and how I do them. There's YouTube videos for that. But before, usually most people do the blocks, which I like as a simple starter. I usually suggest they get the disc in order to sit on and do a lot of extra motions to loosen their spine up and warm it up before they do the exercise. The disc can be used at work. You could put it behind yourself just to keep yourself from slouching. You could sit on it for some extra core activity and movement. It's going to hydrate those discs all day long. And I can tell you, even if you're tired of it and you throw it on the ground, but it's near your workstation, it's going to be that pattern interrupt and remind you, hey, I got to do my exercises. I got to do my movement breaks, right? So if you didn't set your alarms, you don't have any stickers sticking around or little Post-it notes that tell you what to do, you'll see this and it'll remind you. Okay, that's why we love that. So if you really have a workstation at home and you want to do your exercises, you might need 2 of these. The last thing is going to be the foam roller. The foam roller is going to be a way to do self-massage. You can do this all over your body, but for this purpose of your spine, you can roll your spine, your middle back, your lower back, and even your neck on this and start to get rid of some of the adhesions that your body causes because of the bad posture you've had for so many decades. That warms up the tissues and gets blood flowing so that when you do the exercises on these fulcrums have a certain density to them. I think you've probably felt them, but the density is firm but not hard. There are ones that I buy that are harder for the neck in order to try to get a curve back in there, but this density is a perfect exercise and give support on. So the home rehab kit is set up so that you can strengthen your spine, you can get flexibility in your spine, you can add mobility to your spine, and do that all within 10-15 minutes, really. And if you're looking for that, something that kind of reminds you to do it, this is the kit. I mean, this is what it is. So you want to have your adjustments last longer, you get curves back in your spine. You strengthen your spine. You you move your spine more often. And yes, you watch your position at work, you watch your sleeping position. But all these things kind of add together to make really, how do you take care of your spine? You work at it every day, little bits at a time. You know what I mean? That's kind of that's the key here. I thank you all for being on. You guys have a good night. I will see everyone soon. Bye-bye.